I'd like to thank you guys for coming and volunteering and listening to our presentation this morning. We're going to be visiting a little bit about preventative approaches to breast cancer. Primarily interested in looking at the genomics of how we can utilize individuals' gene patterns and DNA strands to help provide and implement preventative measures through exercise and diet. Before we get started though, I think it's important that we kind of give you a little information about ourselves. My name is Heather Barton-Weston. I'm faculty at the University of the Incarnate Word. I have been very blessed to be there for about 5 years now. However, I've been in the field for a little under 8. I started as an adjunct faculty where I was able to get my background in exercise physiology and then a master's degree in health and exercise. I'm currently now working on my terminal degree at the University of A&M College Station, focused on health education and health promotion, so this kind of falls right into the field. Through my experience at UIW, I've had the opportunity and the privilege of working with many of different clients and our colleagues that have helped collaborate on numerous different research projects that are focused on interventions. I've also had the opportunity to help develop different types of interventions there through the University for college-age students. And over the past 5 years, I've been awarded 2 separate grants. So I'm very excited to be able to present this NIH proposal as well. My colleague and co-investigator is Chris Dillon, and I'm going to let him introduce himself and give his credentials as well.
Hello, I'm Chris Dillon. I'm currently the SAC Wellness Coordinator. SAC is San Antonio College. I'm also pursuing my terminal degree in health education. I have been in the field now in health education. I've been in the field a little over 7 years. I come more from a personal training background. I've been a personal trainer for about 13 years. So part of our program today, part of our proposal, we're going to look at exercise prescriptions. So that's more in the area of my background. My population that I deal with now at San Antonio College, I deal primarily with faculty and staff, and have had the wonderful opportunity to collaborate with different departments, also city entities. I work closely with the Mayor's Fitness Council. So we can go ahead and go to the next.
All right, and just so that we can elaborate a little bit of why we decided to do this program together, the intervention in itself, my expertise in developing interventions gave us a unique position to be able to develop the intervention. However, because of Chris's expertise in personal training and exercise physiology and development of exercise prescription for individuals, that gave us that additional expertise to be able to develop these exercise prescriptions for some of our proposed subjects for the study. So what I'd like to do now is I'm going to go ahead and we're going to talk about the significance and why this study is actually important. Breast cancer is the second leading cancer killer to women in the United States. And this is quite substantial. The American Cancer Society has estimated that roughly about 250,000 new cases will be diagnosed with breast cancer in 2013. Unfortunately, because these cases tend to lag in diagnosis, we'll start to see about 40 to 50,000 of those not be successful in the battle of breast cancer. And we really need to try to avoid the initial diagnosis. We need to start looking at breast cancer much like we do with diet and exercise. We need to start focusing on preventative measures. And that's one of the reasons why we decided that the study was going to be extremely important to us. Some of the things that we know that are risk factors for individuals for breast cancer is obviously gender. Women have a higher risk of being diagnosed. We also know age is correlated with risk of breast cancer. The older we get, the higher the estrogen levels, the higher the rate of diagnosis. However, what's interesting behind that is that these individuals who are having higher risks of breast cancer also have unhealthy diets, sedentary lifestyles, high BMIs, and their alcohol consumption is higher than those that are not being diagnosed of their counterparts of the same age group. We also are starting to see now, though, that there is a family tie to this, and there is a genetics that we need to be considering in this particular scenario too. So each of these different risk factors are things that we can take into consideration when we're looking at preventative interventions and ways to help promote healthy lifestyles for these individuals that may be at risk. So let's let's move towards the genetics, because I think part of what we need to be able to do is really identify which one of these subjects are at higher risks. If we can identify them before they get to the point of their lifestyles changing, then we can change the lifestyle and the health behavior behind it. So what we know from current research is about 5 to 10% of breast cancer cases that are diagnosed annually are directly related to their gene. So there is a manipulation. The manipulations that we have found is BRCA1 and BRCA2. Each of these are protein increasing cells that help to ward off cancers. However, the manipulation decreases these protein productions, which means that increases their chance of being diagnosed of breast cancer. So what we're seeing is 2 of them on the manipulations, one of them has a higher rate. The BRCA1 manipulation actually has an 80% likelihood of having a positive diagnosis of breast cancer somewhere within their lifespan. That's significant. That is extremely high correlation. However, if the diagnosis is BRCA2 manipulation, they're still right under a 50% likelihood of having this breast cancer diagnosis sometime in their lifespan. So we need to really take into consideration how genes play into what our future health prospects are going to be. Now we know that the American Cancer Society has already stated that roughly about 50,000 women will lose their lives in 2013 to this battle. And it affects us all. Somewhere down our line we have family, friends that are associated with breast cancer. But the number one way of trying to prevent this unfortunate loss of life is early detection. And genome testing is the most earliest form of testing you can get to help identify these subjects and these women who are at risk prior to ever being diagnosed with breast cancer. So we need to identify which of these individuals are going to be at risk. And so what we're proposing is that we take a look at family members of women who are already currently battling this disease. And these women or these individuals are called the first-degree relatives. These first-degree relatives are the ones that we can now take, identify, test, and determine if there is a gene relation or manipulation based off of that family history. So we need to start taking into consideration looking at the family and not just the patient who is fighting this breast cancer diagnosis, because it is going to affect somewhere else down the line. Now, we found in a study that individuals who are first-degree relatives, when they were asked if they wanted to be tested for the manipulation, 75% of them actually stated yes. We want this testing. We want to know. This is an excellent sign of a mindset that shows that these patients' family members are wanting to take this preventative approach before we ever get to the point of actually having the diagnosis. And this particular group, the first-degree relatives of these patients, are seeing firsthand the devastating effects of this diagnosis. So I think that has to play into their decision of wanting to have this test before they have to fight the same battles that their family members are fighting. Now what's interesting about this is, even though we know that 75% of these individuals would be willing to do the testing, what we have found though is that very little research is actually out there about how positive testing is going to change the health behavior associated with decreasing these breast cancer diagnoses. When we look at theories and behavioral change theories, many of the behavioral change theories out there talk about self-efficacy and the need to increase an individual's confidence in their ability to do the behavior. And what I find interesting is at this point, there's very little research that even looks at the positive aspect of this. What we're seeing mainly is the negative side through the research. So an individual is given the information, it's very negative in nature, and then they're let loose. What do they do now? But there's nothing to follow up with that. So how do we take that and we change it? How do we take this information and manipulate how we approach the information on the delivery of the test results? And how do we take that information and manipulate it to where we can use it as a positive cohort to changing the behavior? And that's what we really need to do. And so the goal of this project is not just to increase the knowledge of the subject's risk to breast cancer, but it's really there more in lines to increase the subject's self-efficacy and adherence to healthy exercise behaviors and diet. And primarily because we know that diet and exercise is a precursor to the diagnosis. So if we have subjects that are already predestined to have this manipulation, then we want to take away the other risk factors associated with that. We don't want our subjects to have to go to such extremes as having double vasectomies and surgeries immediately. Let's find other means of alternative to actually help bring in preventative interventions to give these women the opportunity to decrease that diagnosis risk. And so that's the goal of this particular research study. Now, as I stated, most of the research we've seen so far is basically on the negativity approach. So the focus on this for the behavior change is increasing the self-efficacy of the client. How do we increase the confidence? How do we get the individual to feel good about themselves through the aspect of exercise and diet? We're talking about mainly women. And most of the time, when we look at women, they're very uncomfortable in entering into a gym environment, primarily because they've not been exposed to it. Maybe their diets are consistent of that of a family, because they're the primary caregiver of the family. And so instead of cooking on a healthy manner or on a manner that might be smaller in portions, they're cooking at a higher level manner, and their family is the catalyst to that particular diet. So we need to find ways to identify how we can get this information to them, how we can utilize theory to increase self-efficacy, and how we can actually deliver the information to have these individuals motivated enough to be able to adhere to the healthy diet and exercise programs. And that's the biggest part, is the adhering to the program. We can give the information, but how many of them will actually stick with it?